performing hand hygiene, shutting the door for privacy, or closing the curtain. Hi, my name is Sierra Kavanaugh. I'm going to be your Regis College student nurse today performing your respiratory assessment. If I could just verify your wristband and your name and date of birth, please.
Alexis Roberts of 50902.
And for the sake of this video, is it okay if I record?
Yes.
Okay. So before we start today, are you experiencing any coughing, shortness of breath, or difficulty breathing?
No.
Okay. So from what I could gather today, I noticed that you were able to get onto the exam table by yourself. You're dressed appropriately for the weather. Your personal hygiene looks great. You're sitting upright, and your skin color matches your ethnicity. Now I'm going to be taking your radial pulse. And as I take my patient's radial pulse, I'm going to count the times that her chest rises and falls and multiply it by 2. Okay, and respiratory rate is 16, and your breathing rate is effortless. There's no tripoding, and you're sitting upright. Now I'm going to inspect your anterior thorax, and I will be touching your clavicle, your sternum, and your rib cage for tenderness and masses. Okay, there's no tenderness or masses upon palpation. Now I'm going to be auscultating your lung sounds. So I'm going to be starting off with your trachea, and I'm going to ask you to hold your breath I'm going to ask you to take a deep breath for a second so I could listen for a stridor. Okay, and now I'm going to be listening to your bronchovesicular and your vesicular lung sounds. Okay, so there is no stridor, and your bronchovesicular and your vesicular lung sounds are clear. Okay, now I'll be inspecting your posterior thorax, so I will be measuring your anterior posterior transverse diameter. Okay, so your AP transverse diameter is a 1:2 ratio. I can see that your scapula is equal as it rises and falls. You have no musculoskeletal or spinal cord deformities, and your skin is intact. There's no breakdown, there's no lesions. Your skin color is symmetric with no cyanosis or pallor. Now I'm going to be palpating your posterior thorax on your cervical, thoracic, scapula, and ribs. Okay, so there is no tenderness or masses upon palpation. Now I'm going to be performing a tactile fremitus. So each time you feel my hand on your back, I'm going to ask you to say the word 99.
99, 99, 99, 99, 99, 99.
Okay, now I'm going to be performing a systemic expansion. So you'll feel a pinch on your back, and if you could just take a deep breath for me. Okay, so your tactile fremitus is equal bilaterally, and your systemic expansion is positive. Now I'm going to be percussing, so you will feel this in all 10 lung fields. Okay, and there's resonance in all 10 lung fields. Now I'm going to be auscultating your bronchovesicular and your vesicular lung sounds. Okay, and your bronchovesicular and your vesicular lung sounds are clear.